Ontario enters step 2 of reopening this coming week, and vaccination records are being set almost daily. But some are still wondering if it's possible to have natural immunity against COVID-19 and avoid the vaccines altogether. We put the question to Toronto's Associate Medical Officer of Health in our weekly COVID-19 Q&A.
If you had immunity, it would be that you had COVID. Now, it could be that you had an asymptomatic infection or you had an infection that you didn't get tested. You know, you had symptoms but didn't go for testing and you had COVID. That would be, but it's not that we're born with it or because other people around us had it. If you would only get immunity because you actually got COVID, whether it was symptomatic or asymptomatic. But we still know, though, that if you got COVID, you could still get COVID again. And the way to think about this is, if you've ever had a cold in the wintertime, for example, it's not like, okay, I had my cold this winter, I'm not going to get another cold. Sometimes you can get a cold again, and even sometimes from the same virus. A coronavirus can give you a cold once, and many months later can give you another cold. And that's the same thing with COVID, is that the immunity that you get from getting COVID may not last. It doesn't last for all people. Some people have had COVID more than once, and it also may not protect you against variants. So that's why we recommend that you get vaccinated.
For more on vaccines, including the safety of mixing doses, you can watch the full Q&A on our website, citynews.ca/COVID answers. To go directly to the page and to submit questions for our next session, you can point your phone camera to the code on the screen and follow the link that pops up. For City News, I'm Dilshad Burman.